practitioner. What is your name?
Hi, I'm Casey.
Okay, great. What brings you in to the clinic today?
My well exam.
Okay. I'm assessing Casey's orientation. She's alert and oriented ×3. I'm assessing her behavior and her cognition. I'm assessing that she's addressed appropriately for this occasion. The medical assistant documented the vital signs and the height and weight. We're going to move on to Casey's face and head exam. When I'm looking at Casey, looking at her skin, it's pink, dry, and warm. There's no evidence of lesions. Her facial features are symmetrical. We'll inspect her hair. Her hair is clean, no infestations. I'm inspecting the scalp. Skin on the scalp is intact. No lesions or masses. Any tenderness?
No.
No tenderness on her scalp as well. Okay. We'll assess the cranial nerve number 5, the trigeminal nerve. We'll palpate the masseter and temporal muscles. Casey, clench your jaw, please. Good. Any tenderness?
No.
Can you move your jaw side to side? Can you protrude it out? Cranial nerve number 5, the trigeminal nerve, is intact. Now we'll assess cranial nerve number 7, the facial nerve. We're looking for symmetry. Casey, can you puff your cheeks? Smile, raise your eyebrows. Cranial nerve number 7 is intact, the facial nerve. Okay? Now we'll move on to Casey's eye exam. When I'm looking at her eyes, I'm looking at her eyelids. Can you close them? They close completely. Eyelashes curl up on top, down on bottom. We will assess Casey's lacrimal ducts for any tenderness or drainage. Okay. Any tenderness?
No.
No tenderness or drainage noted. We'll assess her conjunctiva. Casey, look up. Conjunctiva is pink and moist. Okay. Now, Casey, can you cover one eye and then the other? Okay. No imbalance noted on the cover-uncover test. All right. Now we'll assess Casey's pupils. Normally we dim the lights for this. Casey, look straight at me. Good. Okay. Pupils are equal, round, and reactive to light, and a combination. And I would rate them as size 3. Okay? Also, Casey, look straight at me. I'm going to assess the corneal reflex. I'm going to shine light at the tip of her nose. I see the reflection bilaterally in both of her eyes. Corneal reflex is intact. Next, we're going to assess cranial nerves 3, 4, and 6, the 6 cardinal directions of gaze. Casey, follow the tip of my finger with only your eyes without moving your head. Okay, and a combination. Okay? Cranial nerves 3, 4, and 6 are intact. Okay? Now we'll move on to the fundoscopic exam. Casey, just look straight over. Okay? The red reflex, optic disc, and retina are visualized and within defined limits. So keep continuing straight up. Okay. The retina, optic disc, and red reflex are visualized bilaterally, and they are within defined limits. Okay. Now we'll move on to the ear exam. Look at the position of Casey's ears. The pinna is in line with the outer canthus of her eyes. We'll palpate the tragus and the pinna for any tenderness or nodules. Any tenderness?
No.
No evidence of tenderness or nodules upon palpation. Casey, do you have any trouble hearing?
No.
Okay. Cranial nerve number 8, the acoustic nerve, is intact. If there was problems with hearing, the medical assistant would administer a hearing test, the Whisper, Weber, or Rhine test. Okay. We'll take a look inside the ear canals. Tympanic membrane is intact, pearly gray. Cone of light on the right side is at 5 o'clock. Tympanic membrane is intact, pearly gray. Cone of light on the left-hand side is at 7 o'clock. Now we'll move on to the nose exam. When I'm looking at Casey's nose, I'm looking at the placement of her nose. It's symmetrical on her face. We'll move on to palpation. We'll palpate the bridge and soft tissues. Any tenderness?
No.
No tenderness or masses or nodules noted. Okay? In case you have any problems with smell or taste.
No.
Okay. Cranial nerve, number 1, the olfactory nerve is intact. We'll inspect Casey's nasal passageways. Mucous membranes are pink and moist. I can visualize the septum on both sides, and I also can visualize the turbinates on both sides. We'll assess for patency. Casey, can you include one nostril? Breathe in. Include the other. Great. Okay. Nasal passageways are patent. Okay. Next, I'm going to palpate her sinuses, the ethmoid and maxillary sinuses for any tenderness. Any tenderness?
No.
Okay. No tenderness noted on the sinus palpation. Next, we're going to move into the mouth and oropharynx exam. When Casey's talking to me, I notice that her lips move symmetrically. I'm looking at the skin on Casey's lips. They are pink and dry with no evidence of lesions. Okay. We're going to examine Casey's teeth. Smile. Open. All teeth are present. No caries noted and no dental work noted. No abnormal breath odor noted. Casey, can you stick your tongue out? Tongue protrudes midline. Tongue is pink and moist without evidence of lesions. I'm going to examine the buccal mucosa. Open. Okay, sides. Raise your tongue. Buccal mucosa and gums are pink and moist without lesions. Now, Casey, can you stick your tongue out and say ah? Good. Okay. I can visualize her hard palate. Hard palate is fused. Soft palate is pink and moist. No lesions. I visualize her tonsils. There's no swelling. If there was swelling, I'd grade it on a scale of 0 to 4. No exudate, tonsillitis, or crypts. And tonsils are pink and moist. Okay. Also, I assess the cranial nerves. I would assess the cranial nerves number 9. The glossopharyngeal. In case he stuck her tongue out, said the uvula remained midline. Cranial nerve number 9 is intact. If I had a tongue depressor, I'd assess cranial nerve number 10, the vagus nerve. If she had a gag reflex, that would be intact. Additionally, when I'm speaking to Casey and she's talking to me, her articulations of words is appropriate. So cranial nerve number 12, the hypoglossal nerve is intact. Okay? All right. So now we're going to move on to the neck exam. When I'm looking at Casey's neck, I'm looking at her trachea. It's midline. I'm looking for any GVD. No GVD noted. Possibly, if there's GVD when I lay her down, I would expect it to disappear when I sat her back up. I'm going to assess range of motion of her neck. Casey, can you bend your neck down and back, side to side, touch your shoulders, rotate your neck, please. Good. Okay. We're going to assess cranial nerve number 11, the spinal accessory nerve. Casey, can you shrug your shoulders? Good. Shrug your shoulders. Move against my hand. Okay. Good. Cranial nerve number 11, the spinal accessory nerve is intact. Okay. Next, I'm going to feel for her carotid pulse. 2+, rhythm is regular and equal bilaterally. Okay. Next, we're going to auscultate her carotid pulse for bruit using the bell of the stethoscope. No bruit noted. Now we're going to assess Casey's thyroid. Normally we have the patient take a drink of water. Today we'll have the patient swallow. Go ahead and swallow, Casey. Great. No masses, nodules, or goiter noted on palpation of the thyroid. Okay. Next we're going to palpate her lymph nodes, anterior, posterior chains, submandibular, and submental for any tenderness. Okay. Any tenderness?
No.
How about here?
No.
Okay. Any tenderness?
No.
Great. No tenderness upon palpation of lymph nodes. Okay. Next, we're going to move on to the posterior chest and lung exam. When I'm looking at Casey's back, I'm looking at her skin. I'm making sure the skin matches the rest of her body. Her skin is pink, dry, warm. The skin is intact. There's no unusual nevus, no scarring, no lesions, one tattoo. Okay. we are going to look at the anterior-posterior transverse ratio for thorax. Ratio is 1 to 2, no evidence of barrel chest. Okay? All right. Casey, I'm going to have you turn this way, please. We're going to assess lung expansion. Go ahead and take a big, deep breath for me. Good. Lung expansion is equal. Next, we're going to assess for tactile firmitus. Casey, when I place my hands on your back, please say 99.
99, 99, 99, 99.
Vibrations decrease as I move down within defined limits. Okay? Next, I'm going to move into percussing the lungs. Lungs are resonant, which is within defined limits. Next, we will auscultate the lungs. Okay, so just go ahead and take big deep breaths in and out of your mouth, please. Okay. Good. Lungs are clear bilaterally. Okay. Casey, go ahead and swing your legs back this way, please. We're going to move on to the anterior chest and heart exam. Okay, when I'm looking at Casey's anterior chest, I'm looking at the skin. I'm looking at the color of her skin. It's pink, warm, and dry. No lesions, unusual nevus, piercings, tattoos, skin's intact. Okay? I'm going to finish my percussion and auscultation of the lungs on the anterior side. So we'll percuss the lungs. Casey, can you lift your breast tissue up, please? Resonance is heard within defined limits. Next, we'll finish auscultating the anterior lungs. Go ahead and take big deep breaths in and out, please. One more on the lateral side. Good. Lung fields are clear bilaterally. Okay? Next, I'm looking at Casey's, I would try to visualize the PMI. I cannot visualize that on Casey at this time. Okay? Next, we'll auscultate the heart in ape-to-man fashion. Just go ahead and breathe normal. S1, S2 heart sounds are heard, no murmur or extra heart sounds noted. Rhythm is regular. Okay. Next, we'll have Casey lay down. We will auscultate the heart again in ape-to-man fashion. Okay. Again, S1, S2 heart sounds are heard, no murmur or extra heart sounds noted. Rhythm is regular. Okay. We'll go ahead and palpate the apical pulse, mid-clavicular line, fifth intercostal space. Apical pulse is 2+, rhythm is regular. Okay. Now we will move on to the abdominal exam. First thing I'm doing is I'm looking at the skin. Skin is pink, dry, moist, skin is intact, no scarring, no lesions, nothing abnormal. Looking at the shape of her abdomen is flat and symmetrical, equal bilaterally, no peristalsis waves. Next thing we'll do is we'll auscultate bowel, all the 4 quadrants of her bowel. Bowel sounds are present in all 4 quadrants. Okay. We'll also going to auscultate her aorta, iliac, and femoral arteries for breathing. Aorta, iliac, femoral. Okay. No brewery noted. Okay. Now we'll move on to percussion. I'll percuss her abdomen in all 4 quadrants. Okay. Tympany is heard, and that's expected within defined limits. Next, I'll percuss her liver in a top-down, bottom-up fashion. Until I hear dullness right there, I make a mark. spleen. Last intercostal space and move laterally. Okay? And I hear tympany as I move laterally, that's within defined limits. Okay? Next, we're moving to palpation. We'll palpate her abdomen from shallow to deep. And look for any tenderness. No. And no mass is noted. Okay. Next, we'll palpate her liver for any tenderness. Okay, any tenderness?
No.
Okay. Now we'll palpate her spleen. Any tenderness?
No.
Okay. Next, we'll do a deep palpation of her kidneys. Any tenderness?
No.
Good. Tenderness in your kidneys?
No.
No tenderness on kidney palpation. Okay? Now we'll move on to palpating McBurney's point. It's the superior anterior iliac crest, 3/4 of the way to the umbilicus, in the right lower quadrant. Okay? Casey, you let me know if you have any tenderness.
No.
And we'll assess rebound tenderness also. Any tenderness we're going to let up?
No.
Okay. Patient is no signs of peritonitis or appendicitis. Okay. Next, we'll move on to the hip examination. Okay, so you have any tenderness?
No.
Palpation? I'll push them together. Any tenderness?
No.
Good. We'll assess range of motion of the hips. Tenderness?
No.
We'll move them laterally. Tenderness?
No.
Good. Any pain?
No.
Move them laterally. Pain?
No.
Okay. No tenderness noted on hip palpation and no pain with range of motion. Range of motion is intact in our hips. Okay? Alright, Casey, you can go ahead and sit up for me. Now we're going to move on to the upper extremity exam. I'm looking at Casey's shoulders, her clavicle, and her scapulas, and they are symmetrical. I'm going to palpate her joints and her acromion process for any tenderness or masses or deformities. Tenderness in the shoulders,
No.
acromion process, tenderness
No.
down the arms, the elbows,
No.
wrists,
No.
hands.
No.
No tenderness on palpation. Okay? Casey, can you demonstrate range of motion in your shoulders by raising your hands up all the way across your head, back, good, out to the side, above your head, good. Range of motion in the shoulders is intact. Can you flex your arms? Extend. Range of motion in the elbows is intact. Rotate your wrists, rotate them, hands in and out, supinate, pronate. Okay. Range of motion in the upper extremities is intact. We'll assess pulses. Radial pulse. Radial pulse is 2+, regular, rhythm is regular, bilaterally. Brachial pulse. Brachial pulse is 2+, and the rhythm is regular, bilaterally. Next, we'll assess hand grasp. Hand grasp is strong and equal bilaterally. We'll assess cap refill. Cap refill is less than 3 seconds bilaterally. Next, we'll assess deep tendon reflexes. First, we'll assess the bicep reflex. Good? Good. Next, we'll assess the tricep reflexes. Go ahead and dangle your arm for me. Good? Good. Next, we'll assess the brachioradialis reflexes. Good? Good. Deep tendon reflexes in the upper extremities are intact and within defined limits. Okay? Now we'll move on to the lower extremity exam. I'm assessing and looking at her knees, her legs, her ankles, and her feet. I'm looking for symmetry, any swelling, any deformities, nothing noted within defined limits. Now we'll move on to palpation. I'll palpate her joints and her lower extremities for any tenderness or masses. Tenderness?
No.
Down, ankles, feet.
No.
And you can feel me touching me, right?
Yes.
The sensation is intact. Okay, Casey, can you extend your knees and flex them back? We're assessing range of motion. Pull up on your toes, push down on the gas pedal, rotate your ankles, wiggle your toes. Okay, range of motion in the lower extremities are intact. Okay, now we'll assess the deep tendon reflexes in her lower extremities, patellar tendon, Good. Good. We'll also do the Achilles. Good. Good. And we'll also, while I'm down here, I'll assess the Babinski. Good. Good. Deep tendon reflexes, patellar, Achilles, and Babinski are intact. Okay. So now we'll move into the neurological exam. Casey, we'll assess for dystaxia. Can you write your heel down the shin of your opposite leg, please? No signs of dystaxia. Next, we'll move into the explanation of sensory exams. The exteroceptive sensory exam includes the pain and the temperature. Pain, I would have a sharp stimulus and a dull stimulus. I'd have the patient close their eyes. I would stimulate them with one or the other, and they would have to tell me if it's sharp or dull. For temperature, I would fill a test tube up, one with hot water or warm water, and one with cold water. And I would place that on the patient's body, and the patient would have to tell me if it's hot or cold. Proprioceptive sensory exams include the motion, position, and vibration. The way I would do that would be I would explain to the patient with their big toe, this is up, this is down, close your eyes, tell me which position. Great. Okay? Vibration, I would stimulate a tuning fork, place it on the tip of their toe, and ask them to tell me when the vibration stops. Cortical sensory exams include the stereogenosis, which I would place a familiar object in the patient's hand, have them close their eyes, and have them tell me what that object is. Paperclip, key, something like that. Graphesthesia exam would be I would trace a number with the tip of my pen in the palm of the patient's hand, and they would have to tell me with their eyes closed what number that is. 2 points discrimination test would I would have a sharp object, and I would stimulate 2 points on their skin at the same time, or only 1 point, and they would have to tell me if 2 points or 1 point are being stimulated. The extinction test is I would stimulate bilateral points on a patient's body, and I would alternate that with only stimulating 1 point on the patient's body, and they would have to tell me if I'm touching both sides or just one side. Okay? We'll have Casey stand up. We'll have Casey hold her arms out. I'll stand by her for stability. Casey, can you close your eyes? We're performing the Romberg's test. I'd have her hold this position for 30 to 60 seconds. No swaying or imbalance should be noted. Okay, Casey, you can go ahead and relax. Next, we're going to, Casey, if you can start with that wall and ambulate this way or walk this way, please. I'm looking at her gait. I'm looking to make sure there's no limp. Next, can you walk on your toes over there? And then back on your heels. Good. And then back the other way, heel to toe, please. Good. No abnormal findings noted. Next, I'm going to move into the spinal exam. Okay. I'm going to have Casey, I'm looking at Casey's spine. I'm looking at the symmetry. There's no deformities. With one exam with her arms at her side, and then also in the diverse position. Casey, can you bend down and touch your toes? Looking for symmetry. Also going to palpate the spine in this position. Any tenderness?
No.
Good. Paravertebral muscles. You can go ahead and stand up. Any tenderness?
No.
Good. No tenderness upon palpation of the spine or paravertebral muscles. Casey, we're going to continue the range of motion exam. I already assessed her touching her toes. Casey, can you move side to side, please? And can you bend backwards a little bit? Okay, range of motion in the spine is intact. Okay? And that concludes the head to toe exam. Thank you, Casey.